series. We are looking forward to the continued progress of this. Thank you so much to our target chairman, Dr. R.J. Verwain, Mrs. Angel Johnson. They are the target chairman for our Women's Health and Wellness platform, and they allow us to perform these types of community services by having these types of conversations with you. A special thank you to Ms. Rosalind Kaur and Ms. Audra Brown Ward, who you heard from earlier. They are my esteemed co-hosts for this event. They have helped me tirelessly collaborate to put this on. And a special thank you to my sorors who are out there. I see some awesome smiling faces. We miss you. For the Tau Epsilon Omega chapter members that are on the call, thank you so much for joining. Thank you so much for your willingness to allow us to explore these types of topics with the community. So thank you. And to our esteemed panel, let me just thank you in advance for what you are going to share. I jokingly said to them, they are all members of Tau Epsilon Omega. And as I read through the bio the first couple of times, I thought, okay. But then last night, as I read back through the bio just to prepare myself and center myself, I got chills about how much experience and how much strength these three powerful women bring to the table. You will hear from them in a second, so I will stop talking shortly so you can hear from them. I will read their bios, and you will be as impressed as I am about what they contribute to the community and how they serve. But before we get into the heart of what we want to do today, excuse me for a second. Before we get into the heart of what we want to do today, let me take a moment of silence for all those globally impacted by COVID-19. This pandemic has really challenged us. To those who have lost loved ones, to those still in the midst of their battle with this virus, to those who could still succumb from this, to those who are having a really hard time dealing with this, let me just take a moment of silence collectively to reflect on the strength that God has given us to persevere no matter what. So would you please join me in a moment of silence? Thank you so much. Well, we know that this COVID pandemic has impacted all of us. No one is immune to the overall effect of COVID. The goal of today's Pink Table Talk is true transparency. We want to have a real conversation. And if any of you are out there and you've seen the inspirational version of this, the Red Table Talk, you know this only works if we have true, transparent conversation and if you bring your truth. So as you join us today, in the chat, we will be monitoring the chat. Please drop your questions there for us. We will be happy to read those questions if you don't want to say them. If you, in fact, want to share your questions directly with the panel, please raise your hand through the chat function. We will recognize you, and Ms. Brown Ward will help me with that, as well as Ms. Rosalind Kaur. Please drop your questions there or raise your hand. We'll recognize you. We want this to be interactive to make sure that we can get the full effect of this and that we are really addressing your questions and concerns. We will begin with a few questions for the panelists to get us started, but then feel free to engage with us as we go along. Let me read a little bit about our panel. Mrs. Joanna Fuller Crawford has served the healthcare community for over 20 years and has served in many roles, beginning as a certified nurse and assistant to her current position as the clinical manager at Fresenius, where she oversees the day-to-day operations of a dialysis facility. And we do know that this is a disease that affects our community. So she is doing important work. Mrs. Fuller Crawford operates in the premise that teamwork is better than titles. Throughout her career, she has been given situations that require her true, strong leadership through restructuring, and through each task, she has succeeded in taking her team to the top. Living by the motto that it is better to be proactive than reactive has afforded her great success and blessed her career. Joanna acquired her bachelor's in nursing in 2009 and received her master's in business administration in 2019. She is a driving force for change and is a member of Tau Epsilon Omega. Adrienne Phillips, Miss Adrienne Phillips, has been treating mental illness and health and education in the field of, and has been in the field of professional counseling for 17 years. She received her BA in psychology from Hampton University in 1999 and earned her master's in professional counseling from Georgia State in 2003. 4 years later, she became a licensed professional counselor. For the past 3 years, she has been certified to train, teach, and clinically supervise other counselors who want to become licensed within the state of Georgia, and has 13 years of direct contact with treating homeless men and women with severe substance abuse issues. Currently, working in a nonprofit mental health center in College Park, Georgia, she serves as the Adult Services Coordinator. Mrs. Phillips provides counseling services to the entire families and has done so for the past 5 years. She manages a team of counselors and social workers who provide therapy to anyone over 18 years of age, and primarily works with adults who experience mood disorders like depression and anxiety. Her passion is working with women on women-related issues. She is truly a gift in our community and is also a member of Tau Epsilon Omega. And finally, panelist Sarah White. She's a longtime educator with 27 years of experience in the Georgia public school sector. She currently is completing her 13th year as an elementary school principal in the 3rd largest school district in metropolitan Atlanta, where she supervises a staff of over 100 with 650 scholars. Her prior experiences in roles such as elementary teacher, school counselor, administrative intern, assistant principal, and now principal have allowed her to serve in a myriad of communities. Always one to celebrate diversity of her learning community, Principal White's current school has been recognized over the years as Georgia Department of Education Beat the Odds School, a Title I Reward School, and a 5-star climate school. Principal White is working tirelessly to maintain a learning environment that will improve the lifetime outcomes for all of her scholars. In her spare time, Principal White enjoys raising her 2 elementary-age schoolboys, reading John Grisham books, and traveling abroad with her husband of 11 years. Although a native of Minneapolis, Minnesota, she has resided in Atlanta for over 31 years, where she earned both her BA and MA degree in early childhood education and school counseling from Clark Atlanta University. We are blessed to have Principal White guiding our scholars, and she also is a member of Tau Epsilon Omega. So with that, if you can join me, just a quick reaction, round of applause for our esteemed panel as we begin the conversation around COVID-19. We thank you for all that you are doing in the community. We are excited today to hear from you and just cannot wait to engage in our conversation. With that, maybe we'll have our panelists maybe say a little something more than I've already shared about yourself.
Well, I'll start. Ms. Lassane, thank you again. Mrs. Brown Ward, thank you as well for your support. If any of you all know me personally, it is so difficult to write your own bio, or at least it is for me because I don't like to toot my own horn. So I think that everything that has been mentioned has been awesome. The thing that I really want to get across to everybody today is that mental health is so important. It is my passion. It is also my ministry. I love doing the work that I do. I love working with the clients that I work with. I love helping to take the stigma away from mental health. And so I hope that what we share with you guys today can be utilized immediately. Because we know that this pandemic has really impacted everybody in the community. So we're hoping with all of you joining us that what we share with you will be useful and helpful.
This is Joanna Fuller Crawford again. Thank you, Sir Suzette, or Mrs. Lassane, and thank you, Mrs. Audrey Brown Ward. for having me here today. I as well am very passionate about the healthcare industry. It has impacted us in so many ways that you guys can not ever imagine. So please give me your questions. I will try and break down some of the myths that are out there, as well as give you reasons as to why it's impacting us, as well as how it's going to affect us in the long term.
Hey everyone. Again, the other panelists, I do want to thank you for the opportunity. Thanks to Mrs. Lassane and Mrs. Dr. Brown Ward. I'm honored to be on this panel with this esteemed group of ladies. And as I was thinking about some of the things that I wanted to share, I'm also a parent. So I'm not only speaking as an educator, but a parent who's in the same struggle with everybody else. And quite honestly, you know, a lot of the lines get blurred through this. So through education, we're still seeing a lot of the mental health concerns that Adrienne is going to speak about. So I thought it was interesting as I was preparing, I wanted to share that a lot of it kind of overlaps. So you hear a lot of that probably this afternoon. And my plan is to provide tips for parents that are trying to get through these challenging times at home while you're trying to work your job as well. So I look forward to the conversation. So feel free to ask any questions.
We have about 120 folks on the line here. Just remember, we are recording this session. If you have questions for the panelists, please drop them in the chat. The chat is going to be monitored by, I'm going to go with first names now just so we can make it really informal. Rosalind and Audra are monitoring the chat, and we will be talking with Sarah, Joanna, and Adrienne around just everything related to COVID. So I'm going to start off with a couple of questions, and I'm going to throw them to each of you, but feel free, those that are on the call, ask your questions, raise your hand, be recognized, or drop your question in the chat, and we will go from there. Joanna, there is an infinite list of misconceptions around COVID-19 relative to who, what, when, where, you know, and how this is contract the virus, and all this concoction that, you know, you can, all this misconception around the concoctions that you can make up to cure the virus. Can you dispel some of these misconceptions and share with us what is COVID-19 and how does it affect the body?
Sure. So the misconceptions, there are a lot out there, and they can confuse a lot of people. And it can confuse even the healthcare workers, because sometimes people are like, what are you talking about? And especially when they talk about drinking bleach or spraying their bodies with Lysol. No, this does not clear up COVID-19. COVID-19 is basically a coronavirus. It's a respiratory virus. And actually, guys, it's been around for a long time. This is actually the number 7. There's 6 other ones that have been around before this one. And of course, they have had vaccines, as well as a lot more cases where they have been able to, how do you want to say, minimize the risk to everyone, whereas this one is new. And to just sum it up, it's this different strain that's attacking others, and it's breaking down the organs throughout the body, such as the heart, the lungs, and the kidneys. But I remember when it first started that they were saying that older adults and young people are the only ones at risk, but this is not true. Everyone at any age can get it. However, it's the issue is that the older adults have pre-existing health conditions. So they have the pre-existing health condition of congestive heart failure, bronchitis, emphysema, asthma. Then they may be pre-diabetic or a diabetic at the time. So with the pre-existing conditions, it does put them at a higher risk. As well as children, they're saying that children cannot get it, but that's not true. Children couldn't get it. And I think everyone has heard lately in the news that children with Kawasaki's disease, because it's an inflammatory condition within children, that it has attacked them as well, and as well as children with as well as leading into toxic shock syndrome. COVID-19 is also, it mimics so many other different viruses that are out there, such as the flu, or conditions such as pneumonia, or such as congestive heart failure. So a lot of people misconceive or think that it's the flu. Oh, I just have the flu, so I'm not gonna go to the doctors. But this is not true. You need to go to the doctor, because the virus, even though it may feel like the flu, it's not the flu, because it's more serious. And at that point, sometimes you're at the point where it's attacked your lungs. more severely than others. Another misconception is that everyone dies from COVID-19. This is not true. This is not true. There are different extremes and different levels to it. There are some who are asymptomatic, meaning they're walking around with the virus and they don't even know they have the virus. So this is how it's spreading quickly throughout our community, unfortunately. And then you have ones who have some symptoms and some signs, and they're having the fatigue, they're having the shortness of breath, the dry cough, and they're able to still function though, but they don't, how do you want to say, stay home and stay away from people because they're not thinking that they can give it to others. And then you have the extremes to where people are having the aches, the pains, the nasal congestion, the headaches, the pink eye, sore throats, the loss of taste, the smell of mouth, they're having diarrhea, the rash on the skin. And this normally affects the population who are at high risk, the ones who have the high blood pressure, the ones who have the lung disease, the ones who have the diabetes. And at that point, there are a lot of them who are on ventilators. So that's where it comes into play as to where the ventilators come into play. So with that, there's different extremes of the virus. And a lot of times on the news, we hear the most extreme to the person who just got it and never had any underlying conditions at all, which is true. There's some people who don't have the underlying conditions who are walking around asymptomatic, and then all of a sudden they're dying the next day because they did not go get checked out, or they did not test it, or they just didn't know. So I think another misconception that I heard, you can get it through mail coming from China. So spray your boxes down and make sure you don't bring them in the house and all that. But actually, from the research that I've been doing, it can't be spread on boxes that quickly because they're saying that by the time it gets to you, it may not, it's probably already passed through or worn off at that moment. So those are just a few of the misconceptions, as well as what COVID-19 actually is.
No, I think you touched on a lot of things there that I know we've all heard, right? And I think when you have so much misconception out there, there is ability to panic because you don't know what's what. And you are hearing, especially when you turn on the news, from even our leaders, you're hearing inaccurate information. And so it could create additional anxiety with folks that are out there listening. And you touched on something that I think was really important there for our audience here, which is you can be asymptomatic. You can be walking around without the symptoms and be infecting others. So thank you so much for answering that question. I'm going to come back to you so we can go a little bit deeper on our community around that question, but I'm going to pivot a little over to Sarah. Tell us a little bit, with more than 100 million Americans told to stay home, it has inextricably changed the way many of us work, play, learn, and socialize. Many parents are dealing with the stress of trying to juggle parenting, teaching, summer with children, out of school, working, but having difficulties in balancing time to unplug and steal away for themselves. What are some strategies that you would recommend to help parents institute a balance for self-care during this pandemic?
Okay, good question. There are a lot of things that you can do as a parent. First of all, I would say make sure that you're establishing a routine in your home. Although things have changed, students and kids still need that routine. It's a little bit more relaxed right now, but they still have to know what's coming next. You can work with your family to create a routine or a schedule. You can write it down on a piece of paper, put it on a whiteboard. I wouldn't recommend scheduling every single minute of their day because that's a little excessive, but still maintain a routine for waking up in the morning, their learning time, chores, quiet time. Maybe there's a time that you go outside with the family. You might want to schedule their screen time, but things still need to have some semblance as to how it was before. And both adults and kids need the routines that allows them to know, what's expected of them, and also lets them feel like they're still in control of what's going on around them. Because what's happening right now is because of the pandemic, things aren't the way they used to be, so they feel a little bit out of control, and it's easier for them if they know what to expect and what's coming next. One of the other things I would recommend is setting up a schedule so that you have alone time as an adult. That's very important. It could be something as simple as just taking a long shower, running an errand on your own, writing in a journal, taking a walk, taking a nap, I know for my husband, his thing is going to Home Depot. So just getting out by yourself.
Mine too.
I know. I'm like, okay, he needs that time, so he's going to Home Depot. That's fine. For me, I'm going to the grocery store. You know, I might go sit in my car, listen to music, but you do need that downtime to yourself. Kids need it as well. My boys are 6 and 7, but they still need some downtime. They don't take naps. We do call it quiet time, and it's a time where they go to their own rooms. They go in, they can play quietly, they can read a book, but they know that for that hour, they're going to be on their own. They need to just kind of decompress, and so mommy and daddy can do the same thing. One of the other things I would recommend is, you know, right now we're kind of transitioning to summer, but, you know, if we have to come back to the school year and we do have to continue with remote learning, just making sure that everyone has their own workspace in their home. So if your father's home, your mother's home, the kids are home, just make sure that everyone has a space to get their work done. It doesn't have to be their own room, but it could be just the dining room table for one person. Maybe it's the home office for another, kitchen table, anywhere that they can work. So the students and the adults know that this is my space to work. And when I'm at this table, I'm trying to get my work done. And, you know, it allows us kids to know that, you know, mommy and daddy have things that they have to do just like I do. So they know not to disturb you when you're in your space. The other thing I would say for adults is just to establish a support system. It could be just a close friend, a family member, a significant other, maybe your healthcare provider, just someone that you can talk to about how you're feeling. When I said that the lines kind of get blurred with mental health, education, and being a parent, this is one of those things that I think is very important. As an educator, we're seeing a lot of that with our parents. They're just saying, it's a lot, what do I do? You know, please call and check on me. I know you want to talk to my student, but call me because I need help too. So just recognizing that the emotions that you're feeling are typical, being stressed, being scared, you know, having anxiety, just making sure that you're able to talk to someone about that. It could be informally, it could be formally. But just knowing also that it's normal to have these kinds of feelings, you know, and things are just at heightened levels of stress right now. So it's typical. So being able to have that, you know, support system that you can talk to, someone you can speak to about it. And then finally, another strategy I would recommend would be just being purposeful about sharing parenting duties where possible. If there's 2 adults in the home, making sure that maybe, you know, mom might take the schoolwork in the morning and then the dad might take the afternoon duties, or vice versa. Maybe dad's helping them with the logging online and then mom is taking them outside for the afternoon. So you both have time to yourself, but you also have time that you're working with your children. I think we all know that remote learning is a lot. So both parents need to take a break, but they also need to help the students, and then the kids do as well. And I think, you know, it's summer, so it's, you know, we're going to change the way that we're doing things for now, but maybe dad is the one that's doing the online summer learning, and then maybe mom is taking them to an unstructured play or an outdoor activity. But it's important that you share those duties wherever possible, so that neither one of the parents gets overly stressed out. And if you're in a single parent home, you know, maybe that's finding a colleague or a friend or a neighbor that can take the kids for a few minutes while you're just decompressing as well. But wherever possible, to share those duties. And that way you're able to kind of relax at some point and get some time to yourself. So those are the things that I would recommend.
You know, I can't tell you how many times, you know, I talk to friends that are going through this right now, and it feels like they're operating at warp speed. You know, I myself, you know, I've said, you know, 10, 12 calls a day with work, balancing school in the middle. We're happy that we're on summer break, but now, you know, our children are at home with 8 hours of free time while we're trying to balance the steady work and all the other commitments that we're doing. But something that I think is important for us to just make sure we meditate on this call, it's that you talked about the things that parents needed to do first. It's a reason why we tell people to put their face mask on first before helping the person next to them. You are no good to someone else if you burnt yourself out doing all of this. And you might think you're doing the right thing because you're trying to extend and help and be there for everyone. But if you burn yourself out, they now have no one there. So I appreciate what you said. I think those tips are right on for us, especially if I may generalize here. I see a lot of faces that look like mine as Black women. we tend to go very hard and we tend to care for everyone else, and then we put ourselves on the back burner. So the tips that you're sharing, whether you're in a household with two parents, whether you're a single mother in a household, those are relevant tips to care for yourself before you can care for others. And that's a hard thing because we've been reared not to do that. We've been reared to care for our coworkers, our families, our friends, our church members, our sorority sisters, in the case of those that are joining me on the call. And then, oh, by the way, if you have kind of 2% left over, put you, and that's not how this needs to work, right? We know better. We have to do a little bit better as African-American women. Thank you so much, Sarah. All right, Adrienne. To prevent the current pandemic, from worsening, the practice of social and physical distance is necessary, but not social isolation. Why is it so important to stay connected to our community of influence during this pandemic?
Well, I think that the importance of us staying connected is so that our mental health can stay grounded. Sarah gave a list of things that really are just life skills. We just call them that. They're life skills that we need to practice just so we can keep our mental health in the middle. I can say that when we initially had to pivot at work and started, we closed the office and we had to start seeing clients online, we had a week to get it together. So I'm sure there's a lot of others of you who are on this call who probably had a very short window of time to pivot when it came to work. The other thing I can say is I did not think that we were going to be at home for this long. I thought this was just novel. We might be in the house 2, maybe 3 weeks. I was even counting the number of weeks. That's just how novel the idea was. Well, one of the things we know is the longer that we stay isolated, the worse our mental health becomes. Usually what happens when we are isolated or by ourselves is we start to notice our stress level increases. We start to notice anxiety increases tremendously. So one of the things that's important for us to do during this time of physical distance, the 6 feet that we need to maintain, and that's for physical health reasons. And for social distancing reasons, just like today, we're not in a room. We are all in the comforts of our homes or wherever, that we are right now. In order for us to connect, we are all using this digital platform. So one of the reasons why it is so important to stay connected is so that our mental health can stay grounded. It's really important at this point that if for nothing else, the one thing that I keep telling everybody during this time of social distance is find somebody to talk to, whether that's the video conferencing platforms, because Zoom is new. Well, it's new for me because I wasn't really technologically savvy. So all the Zoom, this is new to me. But if you could just pick up your cell phone and call somebody, life skills, simple stuff, right? If we can text, if we can make sure that we are maintaining social distance when we're outside in our communities, those are the kinds of things that we need, because staying connected is so important right now. If people are having issues with anxiety and issues with stress, and just imagine if that person just continues to stay alone as the weeks continue on. I don't even know what week we're in now, 10, 11, I don't know. Anyway, you can just imagine how their symptoms or how they're feeling or their ability to manage how they feel gets harder and more difficult and more overwhelming for them. So that's why it is so very important that you reach out and talk to somebody. It doesn't matter the way that we do it, but it is certainly important that we do.
where you have so much information coming at you that it's okay to just come offline, pause it all, because it's going to be there when you get back to it. And just check in with someone, have that real conversation, take a walk, talk to someone while you're walking, whatever it is that you need to do to reconnect with someone. And don't talk about COVID-19. Talk about other things. So thank you so much for that perspective. The chat is blowing up with questions. So I wanted to give each of you at least the opportunity to answer a question. Mrs. Brown Ward, apologies. Can you help me with the chat? I think I see a lot of questions there, and I think some of them came in earlier based on what was being said. Maybe share a little bit of what you're hearing in the chat.
Sure. So here's a very specific question, and that is, how effective are natural remedies that we keep seeing on TV? So things like increasing vitamin C, vitamin D, drinking hot liquids, doing steam breathing treatments. What is the effectiveness of those?
So this is Joanna Fuller Crawford. That is a very, very, very good question, because I think the latest was an increase in vitamin D. Am I correct? They're not very effective, according to the research that I have been researching over the last couple of weeks, actually the last couple of months. They're saying that it will help boost your immunity, but if you still have that underlying condition and your body is still immunosuppressed because it's still fighting what you're dealing with at the moment, such as diabetes, such as high blood pressure, such as high cholesterol, especially if you're not taking your medication you're supposed to, especially if you're not eating according to how what your pre-existing condition is and what it should be. So they're not that effective.
Joanna, I would just like to follow up. There are several questions in the chat around what it means to be asymptomatic. How often should you test? If you've been tested and tested negative, should you test again? Are there other ways of testing besides the swab in the nose?
Okay, so let's go back to asymptomatic. Asymptomatic means is that you are not experiencing any symptoms whatsoever, such as the fever, shortness of breath, the dry cough, and the fatigue. You're not having that at all. You're ripping, you're running, you're going on your day-to-day business. You're able to exercise like you normally do, but you still carry the COVID-19 virus. That is asymptomatic. What was the other part of the question?
It was about testing. So how often should you test? If you've tested and tested negative, should you test again? Should you test if you are asymptomatic? Should you test just to check and be sure? And are there other ways of testing besides the swab in the nose?
At the current moment, the most positive way to test is the swab in the nose. There is an antigen test that I know everyone is probably questioning right now. But again, it's questioning because they can only tell you if you have had the virus. It cannot tell you if you actively have the virus going on right now. So the swab in the nose is the most accurate right now at the moment. How often should you test? I say test one time. If you come out negative that one time, then start your precautions again. Washing your hands, wearing your mask at all times when you're in an area full of people, but you should not be in an area full of people. You should be within 6 feet. Sometimes people don't understand. You may know your social distance limitations, but others around you may not know that they need to be social distancing, because I've had that happen quite a bit lately. As well as, I will say this, I do recommend that if you have a family member who becomes positive and you are around them all the time and you do not have that mask on, go get tested. You can still have it. The virus is just so unpredictable, guys, that people just don't know. It's really, really unpredictable. The doctors are even saying this is like beyond out of their control. They cannot understand where this is coming from because it's just so unpredictable. So test again if you're around somebody who is positive and you know that they're positive. Do your precautions, your hand washing, your hand sanitizer, your 6 feet, wear your mask when you're in public at all times. And then as well, make sure people aren't running in and out of your house. Just social distance. That is the main key. And we're probably in this for the rest of the year as far as wearing our masks, guys.
No, that's
Go ahead.
well, thank you for sharing that. I think it's important for us to make sure that we're dispelling. And I'm having some internet issues, so apologies if on the video you cannot see me. Hopefully you can hear my voice still. But we are thankful for that response. I appreciate it. There are some additional chats coming in to me privately, as well as the ones that are coming in publicly. In each of your specific areas, education, wellness, the medical area, can you talk a little bit about what the continued plans are? You know, are your areas talking about continuation, 6 months from now, if we're still in COVID, how we're going to react to it? Can you address a little bit of how your specific areas are dealing with COVID 6 months from now?
Sure, I can speak to my school district. I won't name it, but they're considering 3 different options for the fall. The decision really won't come until after July 4th, just to see where we are at that point. But one of the options is just returning to traditional schooling. So face-to-face, everyone comes back and you carry on, business as usual. The second option is to continue with remote learning from the start. So everyone stays home and they continue to learn online. And then the third option is a blended option where students come to school some days of the week and then they stay home for online learning the other days. And the purpose behind that is to reduce the class size, to not have as many people in the building. But right now there isn't a decision. It's not going to happen until after July 4th. So.
In terms of mental health, I know that the option that we're utilizing, that many mental health practitioners are utilizing right now, is telebehavioral health. So we're using specialized platforms where we can still provide individual therapy, couples therapy, family therapy services via a video platform. We are just as concerned about the physical health of the clients as we are for ourselves. Because I work for a nonprofit agency, right now we're trying to figure out when the state will let us know when it is safe for us to go back. We were following all of the precautionary measures that Joanna was talking about earlier, but being in such close proximity in a therapy session is very uncomfortable. So we're still trying to weigh out what's the best way, and we have to come up with a plan as well. Believe it or not, even though we do have the video platforms and secure video platforms to do therapy services, as you can imagine, there are some that don't like this video platform at all. They crave the one-on-one inside of an office, because things that you really don't think about, for example, like Sarah was saying earlier, if you are a mother and you have your own individual therapy sessions and your children are at home, you have to have time alone, and that might be hard for you to try to schedule that. So there are times when video platform doesn't really work. There are also times when a particular person is experiencing trauma or suicidal thoughts, and to see them via video platform for therapy service is really inappropriate. So we would like to get back to the office. However, we still have to take our health into account, as well as the men and women and children that we see in office into account as well. So we'll see what happens.
And then on my end, in the healthcare industry, policies and procedures are changing every day. I have a call about 2 to 3 times a week on the different policies and procedures as to how we need to move forward, because it just depends on what's going on. But the continuance of masks all day long while we're in the facility, as well as face shields, as well as gowns and gloves and shoe covers. My clinic is a testing site. So with my clinic being a testing site, we definitely have to continue to do temperature checks for anyone that walks in the building. We have to get their name, their ID, all of that, because I'm pretty sure when all this resolves, state is going to come in. They're going to want to see all that paperwork and just to make sure that we're following guidelines. We've even taken it, the company has even taken it a step further to have one clinic that specifically houses the COVID positive and the patients under investigation. That clinic is on lockdown and sealed. We wear the tight N95 mask, as well as hair covers, shoe covers, face shields, gowns, double glove. Just depends on how many, especially if there are a lot of patients in there. So for the healthcare field where I am, it's day-to-day policy changes, truly day-to-day.
Thank you so much, ladies. Ms. Brown Ward, did you want to read a few more questions that are in the chat for us?
Sure. So there is a question in the chat about whether the virus can be spread through ventilation systems.
Great one.
I saw that question asked, and I don't have a definitive answer on that. And I say that because if we look at the virus and how it's spread, by the time it's dispersed, it may not get to the ventilation systems in enough time. It's, it's basically already fallen within the feet of where it's been dispersed, whether it's talk, cough, sneeze, however it is. And there was no definitive answer as to if it can be. So in saying that, I would have to say there's more research, and I would definitely have to look at that in depth, because that was a new one on me as of yesterday, as a matter of
fact. There is another question in the chat about healthcare workers and the mental health of healthcare workers.
So I am on the outside. I am in the community in a dialysis facility. The mental health on the healthcare workers has been good in some instances, and in some instances it has not. Of course, just depends on how the upper management works within your company. Now, in the hospital, I do have a girlfriend who works in the hospital, and she said that nurses were quitting left and right. They weren't quitting because of the fact that they were going to the hotspot areas, as we call them, such as New York, such as Chicago, such as Detroit. And there's another one I can't think of right now, to go and help and make more money. But they were quitting because they had younger children at home. I've also seen nurses break down and make videos on my Black Nurses Rock page on Facebook, to where they are now the caregivers of the ones who are coming into the hospital, because their family members cannot come and sit by their side at the hospital. So the mental breakdown on them is real. When I say tearful, crying videos, it is real. And they are just begging everyone to just have your mask, stay at home until all this is over. Now, what they're also seeing is that the patients who are not as critical as others, they're sending them out of the hospitals, and they're sending them home and telling them to social distance. So what does that mean for us? There's a lot more in the community now, guys, that are asymptomatic/symptomatic and know they have symptoms that they're sending from the hospital. So I just ask that you guys pray for the healthcare workers inside the hospital, as well as the ones on the outside in the community. And just, if you see them, just give them a hug. Well, you can't even hug them. I can't even say give them a hug. See, social distance is messing up my mind, because we're used to hugging as a way of compassion. But just give them a thumbs up. Tell them you got your back. You're praying for them. You know everything is going to be all right.
I think also considering the essential workers within the school district, we have custodians that are still working. We have administrators. We have the school nutrition department. We're serving meals every Wednesday to families. So, a lot of us that are still coming to work each week, we're still, out there as well. But the districts have put in place a lot of the same measures that I know Joanna was talking about. You have to check your temperature every time you enter the building. We have to wear face coverings. Obviously, you're practicing social distancing as much as possible, washing hands. Our custodians are going through classrooms. Even though no one's here, they're going through classrooms and sanitizing over and over and over again. So, you know, it's just something to consider. I know somebody asked a question about the level of comfort with students coming back. And honestly, I just think a lot more needs to be done and considered. Some of the guidelines that came out from the CDC for reentering the school in the fall were pretty stringent, pretty difficult to manage, in my opinion, even with the transition of kids coming on some days and then not others. So it's a lot to consider. I think it'll be good for us to see what's happening in July, in August, and then make a decision at that point. But right now, you know, whenever we re-enter or come back to learning, we have to consider the fact that we're going to now be dealing with additional students and staff that are in more of a trauma mode than anything else. This has been very trying for a lot of people, not just the kids, but the adults as well. So this is where the social emotional learning comes into effect. We have programming for that in our school. Our district is starting something new, not because of COVID-19, but just in general, because it's something that has definitely been on the rise over the past several years. And I can't tell you how many times I've walked out to somebody's car over these past several weeks to give them a work packet, and the parent is like, I don't know what else to do. This is so hard. And we basically just tell them, you know what, do what you can and let the rest of it go. You need to take care of yourself. But a lot of them are, you know, they're going in the bathroom, they're sobbing in the bathroom because they don't know what else to do with their kids. They're going, you know, they're just having you can see a lot of mental health breakdowns. So for us coming back, it's, you know, a lot to consider. We want everyone to be safe. But then there's also things that, you know, have to continue running within the school district. So it's something for us to consider as well. And hopefully we'll know more, you know, later on in July as to what the expectations are going to be moving forward for us.
We appreciate that. Sarah, I think it's so important that we don't overlook kind of just all the dynamics with the parents as well. For those that are on the call, we will be in about 10, maybe 15 minutes, we will be putting up some slides that show a little bit more around some resources, things to do with your kids, things to do, you know, for those that are caregivers. We also have information and in a resource that we're providing around where there are some testing sites in our communities. So that will be coming up in a few minutes. I know there's a couple of questions in the chat around that. I know I might be having some issues with the internet connection. Hopefully you can still hear my voice. But we are going to be putting those resources up shortly. Mrs. Brown Ward, can you continue with the question? Can you continue,
Sure.
Mrs. Brown Ward?
Yes.
Any questions?
Sure. So there is a question about, I saw this was a really good question, about how to approach the topic of COVID-19 with young children while helping them understand the importance of social distancing without invoking fear.
Okay, thank you. That's a good question. Some of the things that I would say that you might want to do is, number one, just listen to your child, what their fears are, their concerns. They're hearing a lot. They're seeing things on TV. They're hearing adult conversations, and they may see your concern or pick up on your body language. So just listen to what they're having to say, and you can have a conversation with them about it and about their fears. I think the main thing is just to help them cope with it and kind of work through the fears. You know, you can't solve the problem for them. We're not doctors, we're not scientists, but you can help them cope with it. I think, and that's the most important thing. A lot of times as parents, we want to solve their problem and make it go away, make them feel better. But in a case like this, you really just have to listen and, you know, say, I hear you, I hear what you're saying, and admit to the fact that, hey, mommy's scared too. But one of the things, you know, you can do is talk to them about how you're gonna, you know, remain healthy and try to prevent, and hey, this is why we're washing our hands, this is why we're gonna wear a mask if we have to go in public, you know, and kind of remind them about the things that we're doing to stay healthy versus, you know, scaring them even more. And I think with the younger kids, sometimes it's harder because they have a harder time expressing themselves. So it may come out as something else. Maybe it's a misbehavior because they're stressed. They don't know how to tell you they're stressed. maybe it's anxiety that you're not seeing and you're not recognizing the symptoms. So, asking them questions about how they feel or trying to help them work through how to express themselves. Here at school and even at my house, you have like boards that have feelings, and kids can just point to them if they can't tell you how they're feeling. Sometimes you can have them draw a picture and try to explain their picture to you. And, just having that conversation about what's going on and how to stay safe and stay healthy during this time, but definitely recognizing their feelings and letting them know that, you're human too, and you're experiencing some of the same things. But I think the main thing is just working with them on how to cope with it versus trying to solve the problem. That's one of the things that I would recommend.
Excellent, excellent. Let's see. Any other questions, Mrs. Brown Ward? I think I know I saw a few others.
There's a couple questions. There's one on as a frontline worker, how do you keep your sanity? And then there's another couple questions I see about transmission of the virus through the eyes. And so should we not wear contact lenses during the pandemic? So
I think it's open to the people. Yeah, thank you, sir.
So,
Ms. Fulcrum.
okay, so let's go back a second. If you have been tested negative, and you know that you are negative and you have not been around anyone who has tested positive, they continue to wear your contacts. Just wash your hands very well. Make sure that your face is covered and you have a mask on when you are around other people in the environment. If you feel as though there's a possibility that you have been around someone who is positive, then don't wear your contacts. Just leave them home and just wear your glasses. Wear your glasses will serve as a barrier versus the contact. So it's just really up to you as to what you would like to do. What was the other question, Mrs. Ward?
It was about how to maintain your sanity as a frontline worker. I think that was meant for Adrienne.
Well, I'm going to defer to Joanna first since she's on the front line, and then I'll follow up.
I know in my clinic, we pray every morning before the doors open, and that's how we maintain our sanity. I know sometimes they say don't bring prayer into your job, but I'm sorry, I'm bringing it into my job and my space, because as a nurse in dialysis, we not only deal with just dialysis, we deal with the mental, we deal with the emotional, we deal with the psych side, we deal with the worrying about my mama's in the hospital now and they can't talk to them, they can't go in there and see them. So we do a whole gamut of mental, social, physical, just everything. And so even to the point of with kids, and we deal with it all. So with me and in my house, we pray before those doors open so that we can make it through the day smooth running and no issues.
So I think what Joanna is trying to get across to all of us, because we've used prayer as a way to center ourselves or to calm ourselves or to get some reassurance for ourselves. And so if prayer is the way that you do that, pray. But what's super important in terms of dealing with sanity is you've got to be able, number one, not to take home the things that you did at your job to your house. Now, that's easier said than done, I realize, especially like Sarah was saying, with parents who are at home working and who have children who are at home doing school. So it can be difficult, but for frontline workers, just imagine, here we are in May when the outbreak occurred, and when we had full awareness of this was in March. So every day you are putting on your battle clothes and you are headed into work, and there's a lot of uncertainty and there's a lot of anxiety, which if not dealt with then turns into hysteria. And so if I'm holding on to all that stress and tension and anxiety, what's going to end up happening is I'm going to have to find a way to deal with it. And so the way we choose to deal with it can either be beneficial or it can complicate the matters that we're trying to address. So keeping your sanity means, where's the balance for me? It's going to be prayer for some folks. It's going to be exercise for other folks. It's going to be the quiet time like Sarah was talking about before, where mommy and daddy just need time alone. Where is the balance? Whatever you have to do to figure out where your balance is. The other thing I want us to all keep in mind of the simple things when we are in, just go mode, the basic things in our lives, we will either forget to do or we will start to limit. For example, if I am doing frontline work and I'm out there grinding, I'm probably not sleeping like I used to. Once my sleep starts to shift and change and I'm not sleeping like I used to, I'm going to get irritated. And then I got to go to work, or I got to handle my children, or my spouse is getting on my nerves. And so now the situation begins to escalate. It gets worse. It snowballs, right? So we have to find ways, again, to find the balance, and the little things like getting enough rest sounds, pretty simple. That's because it is. Making sure that we're eating things that are going to give our bodies nutrition and strength and things like that, so we can just function, so we can just get through the day. And this is whether we're frontline workers or we're at home, working from home. Simple things, like I said, exercise. If we're doing a lot of sitting, especially those of us who are working from home, we need to move. We need to get our blood flowing and pumping. We need to get some cardiovascular exercise or something going on. So we need to do the simple things in order for us to, again, maintain the balance, because if we can't, our bodies will definitely let us know. And then the other thing that's going to start to change and shift is our attitudes and our emotions. So whatever you got to do to get centered and to find the balance, do that consistently so that you can maintain your sanity, whether you're a frontline worker or you're at the house with your children.
And that's so important. I think there's a stigma, if I can generalize just for a few minutes with this group, there's a stigma in our community that, mental illness is something that we can't talk about. And the more we continue that stigma and shove it down, the more difficult it becomes for us. And I will tell you, as African-American women, we deal with a lot, and we tend to not take it anywhere. And so we will, in a few minutes, begin a slide, and you will see that there are some numbers on there for if you are looking for a licensed professional counselor. There are some organizations that can help you find that. There's information around suicide prevention. I think we have to, the way we self-care is begin talking about those things that cause us to feel isolated, that cause us to feel alone, that we're the only ones going through this, right? I have noticed my own pattern in all of this is, I tend to have 10, 12 meetings a day. I'm dealing with work, I'm dealing with clients, and then I come, it's 7 o'clock, I just don't want to deal anymore. So I turn the TV on, and then I have the bad pattern of watching TV till late in the night because you just don't want to think and you want to get away from it all. And so we all cope differently. I'm not exercising as much as I used to. I'm not connecting as much as I used to. So I had to recognize those patterns early to stop them, because it was becoming one of those things that I'd go to bed at 3 o'clock in the morning, wake up at 7, and now you're reducing sleep. And it's that cycle that you talked about, losing sleep, irritated, and you're going through all of this. But let's first begin to acknowledge, can I get a collective reaction in the chat here from people? Thumbs up, fingers, whatever you want to do. Show me that we understand. It's important that we talk to someone. And if you feel overwhelmed, please seek help. Let's not be ashamed of getting the help that we need to cope, right? We are the only culture that finds that to be very difficult. And in order to preserve us and teach our kids that it's okay, we have to seek help first. So thank you for that acknowledgement. Thank you for reacting to that. I am loving this conversation. You guys are on fire. This panel has been amazing. We still have more to go, so we are not ending right now. We still have about another 20 minutes to go. I think that there's some more questions coming in. Mrs. Brown Ward, can you let us hear another question that's in the chat?
Sure. How can you keep your home sanitized if you are high risk, but others in the home must leave and go out in the community for work?
Great question.
So I'll tap into it just a little bit. I think what I do to protect my home is I strip at the door. I take all my clothes off at the door and I put them immediately into the washing machine. And then I get into the shower and I just go from there. A lot of times I do know some care workers who have actually isolated themselves into an apartment or a hotel from their families because they were in and out so much. And they're mainly in the hospital. So they were in and out so much. That's what they have chosen to do, and it works for them. But if it's a choice to where you have to go in and out for work, take your clothes off, wash them right there at the door. Make sure you sanitize your hands, wash your hands, take a bath immediately, and then just go on. Make sure you clean the house with Clorox, Lysol, bleach, everything. Just wipe everything down. Wipe the counters down after you finish. Wipe the door handles. Wipe the bathroom door handles, wipe your bedroom door, all the door handles, just wipe everything down that you touched, the refrigerator, the drawers, wipe everything down.
Excellent, excellent. I apologize. Allegra Morgan, you have had your hand up for some time now. You can come off mute and ask your question? Let's see if I can. There you go, great.
Yes, good afternoon, everyone. My question was actually for Ms. Sarah White, but I think she kind of spoke about it a little bit. I wanted to ask her about her opinion about the 3 options that her school district was planning on trying to open up school back in August. And, you know, do she think it's feasible? And also considering the CDC's recommendation, just your outlook on the options that they included.
That's a good question. You know, I give it a lot of thought. I'm definitely not an expert on, you know, COVID-19 by any means. At the end of the day, I just want to make sure that we're doing what's safe, not just for the students, but for staff as well. I mean, we have guests in our building as well. And, you know, the guidelines that the CDC put out are basically guidelines and recommendations, and each state and, you know, Department of Ed is going to have to determine how they can utilize them to work best for their districts. So, you know, I really don't know what would be best. I feel like we need to wait and see until July and August to see what's going on. I'm kind of more a proponent of continuing with remote learning until we know that everything is okay. You know, bringing everyone together to me is a little scary at this point because you just don't know. And then we have a lot of students who live with grandparents. They live with people who are sick already. So I'd be concerned that they would take something back home to them from school if that's, you know, if they caught it from somebody at school. So for me, I just want to wait and see, you know, see where we are as a state in July, in August, and then make a determination. At the end of the day, I think it's just, you know, we have to just continue to practice, you know, these safe habits, having the mask on, washing hands, staying within 6 feet, and see what happens at that point. That would be my best recommendation for now.
Sarah, can I also
Thank you.
Oh, I'm sorry.
You're welcome.
Sarah, let me piggyback off of what you just said. And I think, again, this goes back to our discussion of how education and mental health can overlap. I think at the core of what you just described was uncertainty, period. Right. No matter what the school district decides, it's out of your hands. All you can do is follow through with the directives that are given to you. Miss Morgan, you are asking, I'm sure because you have children in the school system, so you're trying to figure out what's your best laid game plan as well as to, you know, how do we move forward with uncertainty? And so with all of that said, it breeds a sort of tension in all of us because we don't know what to do. There are going to be some parents who make some difficult choices and decisions as it relates to their families. There are some families, truth be told, who are in difficult decisions when the school district closed the schools. There are some children who have been negatively impacted because they're at home. And so all of this uncertainty, if unaddressed, we internalize and things continue to feel like they get worse for us. And then we may find ourselves again annoyed, frustrated, angry, easily upset. We may even, Joanna, we may even feel physically bad because we're starting to now internalize the uncertainty and the stress of it all. And so one of the things I just want to emphasize is, even though we're not sure, I have never watched more news in all my life because I want to know updates. I'm not necessarily concerned what the president says. That's a whole nother issue for a whole nother day. But what are the scientists? What are the people who went to school for this? What are the experts saying? Because the more information that I get, the better I can make decisions. But at the end of the day, the thing that I want us all to understand is, even with the uncertainty, it's this community that we are all interconnected with that can help us to relieve some of this uncertainty, some of this anxiety. Because right now we're all trying to figure it out, and nobody has the perfect answer for any of this. But what I do know, all of this is interconnected. The medical questions that we have, because, you know, can we wear contacts? You know, can my children go to the swimming pool over the summer? Like, all of these questions, again, is because we're all concerned. We're not sure what to do. But the strength in this situation, the way that we're going to make it through the situation, again, is to stay interconnected. We have a whole platform where there are at least 100 women who are on this platform, who are all just trying to get as much information as we possibly can. But the thing that I see is that we're all together. We are all trying to utilize the strengths and the talents that we all have so that we can make better informed decisions. So even though we don't understand it all, and even though day to day there are, you know, new developments and new things in the news that are happening, please do not forget that you can reach out to your sister, to your girlfriend, to your cousin. Stay connected during this, because that is what's going to help propel us forward as we move through this.
And to piggyback on that with Sora Adrian, if you know someone who's in the healthcare field, stay in contact with them, pull them in every night. Say, hey, how are you doing? Hey, how are things going? Because some of us are running, going, because the job is demanding us to go and to run. It's not because we want to do it, it's because we have to do it to continue to bring in that income for our family. So, and sometimes businesses don't understand that, okay, hey, we got to stop because we're wearing down our workers. They don't understand that. They don't see it. The only thing they see is they have an influx. They have to fix it. They see the numbers. They have to fix it and to make sure everything is great. So if you know anybody in the healthcare field, reach out to them. Send them dinner. Send them Uber Eats, Yelp, just whatever you can do, because especially if they have families, and now all of a sudden they have depended on daycare, to take care of their kids while they're working. So now they're really strapped because they have to go and work 8, 12, 15, 16 hours on their feet. They're not sitting down, but on their feet. And now they have to come home and feed their family, as well as make sure they're not bringing home what they had to deal with at work into the workplace. And trust me, in the healthcare field, they're still trying to figure it out. So common sense is playing a huge role for us in the healthcare field as far as infection control, even before they even send a policy out sometimes. So definitely continue to reach out to the healthcare workers.
And I would say, you said a lot around, if you see first responders out there, whether it's an educator, if you know your neighbor is a principal, if you know their first responder, play it forward. If it's a stranger and you're in line at the grocery store, which I seem to spend a lot of hours at the grocery store these days, I think that's how I'm coping. It's by cooking, and then, eating all the cooking, which is, again, not the best thing to do if I'm not moving as much, but we are all coping best we can. If you are in line at the grocery store and you see someone in their, their clinic, vest, or hospital, someone that that they're in the middle of battling COVID-19, play it forward. Pay for their grocery. Give them $20, whatever it is, just playing it forward, because I think it's important that our first responders understand that we know what they're battling with is really hard. And that's a way to play it forward as well. So thank you so much to the panelists for your responses there. I believe I'm seeing still some additional questions in the chat, and I'm going to get the presentation back up for you, but if you were looking at the presentation, we'll continue to show that and make sure that that's replaying. But that presentation does have a lot of aid in there and assistance around testing, where you can also get counseling and therapy, and then also some things that you can be doing with your kids home during this time. There's also information in there that if you are interested in the slide, we can share that with you. So by emailing programs at akateo.org, we will get that information over to you. And that information is going to scroll on the slide as well. So Mrs. Brown-Ward, can you share any other questions that you have in the chat?
Sure. Here's a question. It says, I work in a local hospital with cancer patients who are already immunocompromised. So I'm used to practicing excessive infectious hygiene. How would you suggest integrating back in congregation with family members that you know haven't shown signs of infection, but could be asymptomatic?
I recommend say keep your social distance. If they have not been in your presence the whole time since we have been on lockdown, I say still social distance. Complete social distance. Do not let them in your house. Love them from a distance, because you don't know. You don't know. And one person can come in and infect the whole house. For instance, we have a patient at a clinic who had family come in. They got sick, didn't know what was wrong with them. All of a sudden, they heard that their family member got sick. What happened? They came into the clinic with dialysis patients who are immunocompromised already, and the whole clinic got sick. So the trickle down is rapid, but they didn't know because it takes 2 to 14 days before the symptoms of signs show, correct? So they didn't know. So with that, I say just continue to social distance. If you have not been around them during this time, if you have been in isolation or shutdown, just continue to social distance.
Can I piggyback off of what Joanna said? And I think her continuing to tell us, utilize the precautions that we've already heard. And we're asking her, well, what about this scenario? What about that scenario? And is it different if it's in this? Is it different if it's that? And I think because what we're really trying to figure out is, when is it safe to be back with the people I love? When is it okay for me to give the healthcare workers the high five or the hug? And it's because we still don't know. We're still, the healthcare workers are still trying to figure it out. That's what Joanna was saying. They're still trying to figure it out. And I think as individuals and as families and as communities, we're reaching a threshold where it's becoming more and more difficult to maintain this distance, even though we're hearing from a healthcare professional that, yeah, we still need to, it's getting hard. We're reaching a limit, and we're trying to find ways around how to deal with the limit, because we've hit the ceiling. And I think what Joanna has been saying to all of us is, keep your mask on when you're in public, wash your hands, keep the social distancing, because we don't want to infect anybody else, or we don't want the virus to spread. But the part of that we're struggling the most with is, but I miss my loved ones, and I miss my sorority sisters. I miss seeing y'all in public. I miss being able to give y'all a hug. I miss my church family. I miss my girlfriends. We have done like Zoom happy hours, and we've been as creative as we possibly can. But at the end of the day, we miss the regularity, the normalcy of just being able to shake a strange person's hand or give a hug to our grandchildren, and send the children to school, and having some sense that they'll be okay while they're there. So we're struggling because we're distant. But even though we've reached that threshold, what I'm hearing Joanna say is, but we got to keep going, y'all. And we got to keep being creative in terms of how we're going to continue to remain connected with one another. And this is stressing all of us, the healthcare workers, the parents at home, and everybody. It's stressing us all. So it is now the most important time for us to do what it takes to protect your mental health, protect your peace, to protect your sanity. You're going to have to take even greater steps to make it a priority for you, because we are all at this threshold where, you know, it's getting thin. It's getting real thin right now. But you got to do all the things that you need to necessary until the medical professionals can tell us it's safe.
And I think that's the challenge with coming back to school right now. Is imagine a room full of students with masks on. First of all, you can't breathe in them. That's one thing we've noticed as we've been working in the school, just a few of us. It's very hard to talk to other people. Imagine trying to keep the mask on 22 4-year-olds, or we have students with special needs. They don't understand why the thing on my face, they're going to take it off. So you also have to think of those kind of precautions as well. You know, in the field of education, it's very hard because one of the main things that we miss as educators is that personal connection. You know, we're used to looking in the eyes of a student to see, do they really understand what you're trying to teach them, or giving them a hug, kneeling down on their level to say, hey, I see that you're not understanding, let me help you, or, you know, come to my back table, I'm going to show you how to work that math problem out. So I think that's one of the hardest things that, you know, that educators are going through right now. You can't have that connection with them. You know, the other thing is there was no training for this remote learning. So talk about a pivot. For us, we had a day to turn it around and then come back to school and teach everything online. So, you know, teachers were learning with students, you know, the technology platforms hadn't been utilized in the classroom. So not only staff, but also parents, kudos to them for everything that they did during these past 6 to 8 weeks. It was just incredible how amazing, you know, people could get on board, and it was a very quick shift. So just know that on the educators end, we want everyone to be safe. We want our kids to be safe. We want our families and our educators to be safe as well. So, you know, coming back with a lot of these, you know, the recommendations and wearing the mask and things like that, it's going to be hard. It will be hard. So I'll be interested to see what happens. But I think, like Adrienne said, we're all kind of at a limit at this point. I'm actually very glad it's the summer. Although I'm a principal, my kids still struggled with it. I struggle with it as well. We work, but I think at this point, I think parents need to understand that it's summertime now. So let the kids play, let them have fun, let them go outside, you know, don't worry about the work at this point. It's done for now. There are a lot of things you can do online right now. I know there were a couple of questions about that. A lot of great websites. There's a lot of virtual tours online. There's museums. You can go to the zoo. You can go to farms. There's so many things you can do. You can just Google like online trips and you'll find a million different things. Elementary summer learning. Now for some of the districts, there are learning packets for the summer. They're not new learning. It's basically reviewing, and you can continue to review with your student the things that they had to learn this year. If you go to, let's see, there's idtech.com. If your student likes STEM activities, some of them can be kind of pricey. I know that Varsity Tutors is also important. I know that was mentioned in the chat box. They have a lot of online courses kids can take for free. So just explore. There's so much out there. I know Atlanta Parent Online has tons of virtual camps. So just take a look and remember that it is summer. So let the kids be. They can have a minute, you know, give them a little bit of time with education, let them review, get a workbook, let them go online. There's a lot of online programs like iReady, iRead, things of that nature where they can continue staying sharp, but also give them the chance to just kind of relax as well.
The space to just create balance for them too. I think that's so important. You know, pivoting a little bit, we talk about the space, and, you know, we've touched a lot on, you know, the mental piece of this. There's a question there in the chat, and it talks about, you know, folks are hearing, some folks have been laid off, and we know the stress and anxiety that comes with that and the inability to care for your family. And then some folks are being asked to work in an environment where they know the layoffs are coming. So can you really talk a little bit more to us about, you know, how do you cope with that, knowing that that's coming and seeing maybe even friends that are being laid off in the midst of all of that?
That's difficult. Anytime that we have upcoming job loss, or we could be underpaid at this point. So, we were making a certain amount, and with the economic shift that has occurred as a result of us all being in the house, maybe we're earning less money. Maybe we're stressed about receiving unemployment because there were people who had applied a long time ago, still are waiting to hear. And so all of that is difficult. And so the thing that I can honestly say during these times that's going to be the most important is finding hope. Now, it gets real hard to be hopeful when I'm stressed or I'm overwhelmed, or I know I've lost and I'm upset about it, or I don't know how I'm going to make the ends meet. But I think because, and I think this goes back to Suzette, what you were saying before, we are socialized as African-American women to figure it out. And that's what we do. We find ways creatively to make much from little. And so as long as we can find some hope in the situation, as long as we can understand that this is a temporary situation, this is not going to be always. Even like Joanna was saying before, we might still be in this situation until 2021. However, that does mean that there is an end to this situation. And however we're impacted negatively by this situation is going to require some hope in the situation. And so whether that is, talking to a friend, whether that is, your utilization of your faith, whether that is sharing resources, again, because we are African-American women, we know how to make much out of little. And so the thing that I also want us to keep in mind is even when we're struggling, if we can find silver lining about something, if we can say, thank you, Lord, for just one thing, usually that thank you, Lord, for the one thing can turn into a second thing. And so again, I got to be able to figure out find some hope, even if it's the thinnest silver lining in the situation. I gotta be able to find that. I gotta be able to hold on to that, because that's what's gonna help me through. And so I want us to keep in mind that this is temporary. We will not be going through this for the rest of our lives. The other thing I want us to keep in mind too is, Joanna was saying this, some folks didn't see today. Whether that was COVID-19, whether that was underlying health conditions, whatever the situation is, some folks didn't even see today. So the fact that we got another day to make a difference, to figure it out, again, let's find some hope. Let's find the silver lining somewhere. Let's remind ourselves we got some stuff we can be thankful for, even in the pandemic, even in the face of loss. So that I just want to add that little piece.
I think, Adrienne, another thing is just to remember, I know pride is a huge thing, and as African-American women and families, we feel like we can just do it all, but honestly, use the resources that are out there. Every school district meal stops all summer long. Kids can get 5 meals in one sitting. They get breakfast and lunch for 5 days, free of charge. You don't have to say your name. You just pull up to the school. I have 5 kids. Boop, it goes in your trunk and you're gone. Honestly, I think, people it's really important. There's so many resources out there. We even have food delivery up here in Sandy Springs, where people actually bring the groceries to your door. All you have to do is text a number and they bring it to you. There's no questions asked. So hopefully we can kind of be okay with asking for support. And honestly, there's no judgment. When you pull up at the school, we're like, hey, how are you? How are you doing? We just try to make sure that they are okay, and then drop the groceries in the car and then move on. There's also resources within the school district, reaching out to the social worker for your school, reach out to your principal. We work all summer, so we can connect parents with any type of resources they need for themselves or their students. So I think making sure that we're not feeling like we're too above getting that help, because honestly, everybody's pretty much in the same boat. But there's so many things that you can get support with through your school district. So just don't forget that as well.
And to tag on and piggyback on Sarah and Adrian, just continue to use your stress techniques, stress-free techniques. I know it's going to be hard, but when you stress, guess what? You become immunocompromised. Your immune system decreases. So what happens? You come into a semi-moderate high risk category. So make sure you guys take from what we have told you today. So wear your mask, sanitize, wash your hands, cover your mouth, exercise. If you pray, pray. If you jump out the window, not out the window, but just jump rope, whatever you do, however you decrease your stress, just do it. I didn't mean jump out the window, guys, but just do it just to relieve that stress so that your system does not become immunocompromised.
Thank you. I don't know about anyone else. We are still over 100 folks on this call, in this video chat, but I feel like I have been blessed. And I have been working with these three powerful women for the last couple of weeks to put this on, but I have been blessed. You have distilled the myth that we are superheroes. I have told someone in the past, I don't want to wear the cape. I don't want it. I know that sounds fun, and that's what we've all been taught to do is get the cape, keep the cape. I don't want it. And so what you have shared with us today is a way to loosen that cape, let it fall on the floor, and reach for that mask and put it on. Thank you, Mrs. Sarah White, for your information around being a parent through this time, around how schools are thinking about this and how as parents we should be thinking about this come fall. Thank you, Mrs. Joanna Fuller Crawford, for your expertise in the field of medicine to educate us on what is the coronavirus, what are the myths around it, how are first responders impacted, how can we make sure we keep ourselves safe. And last but certainly not least, Ms. Adrian Phillips, thank you so much for your, the work that you do is so significant in our community because it helps us battle this stigma about who we are as Black women, who we should be, and that it's okay to find help. And that it's okay to acknowledge that we are all going through this together. We all have very similar thoughts, feelings, and emotions around all of this that's coming at us, but it's okay because the light is there. And we are all on this call breathing, and that is a blessing in itself. So I am honored to have sat with you today. I have been honored to have been the moderator for this awesome, awesome, awesome panel. Show me some love, some reaction if you were blessed by this conversation. I see some lighting up there. Thank you so much. Let me, I know we're at our time. Let me thank my awesome co-host, Mrs. Audra Brown Ward. Ms. Rosalind Kaur, thank you for your help in bringing this vision to life. We are excited about the Pink Table Talk series. This was honest, true conversation. We want to make sure we continue that. Let me also, I would be remiss if I did not thank my chapter of Alpha Kappa Alpha, which is Tau Epsilon Omega. I see some of your faces out there, and I see some pretty pink and green out there. Thank you for the work that you do. Thank you for encouraging this committee for the work that we do. And thank you for your service in the East Point College Park area. And for the guests that have joined, thank you for your energy. Thank you for your questions. Thank you for your transparency and asking the questions that are important. We did not want this to be a conversation about, hey, all this hypothetical stuff. We want real conversation. So thank you for asking the right questions to get the right conversation going. And most importantly, thank you to our first responders. If you are out there and you're a first responder, you're an educator, you're a counselor, you are on the front line dealing with this. Dr. R.J. Berwain, who is the chairman for this platform, she is in the middle of dealing with folks that are going through the emotional challenges with this. Our other chairman, Angel Johnson, she is also on the front lines as well. So we have two ladies that chair this committee that are on the front line battling what's going on right now. And I just want to thank them and thank your first responders. But to all that have joined us today, we are thankful. Be blessed today, and let's play it forward. And let's keep ourselves safe and make sure we're caring for ourselves. Namaste. Thank you, everyone. Thank you for joining. For those out there, if you still want the presentation, as I mentioned before, we do have the presentation available. Email us at programs@akateo.org. Thank you so much for your time today.